Horrific scenes of gun violence shaking many of us again this week when a gunman killed 3 students at Michigan State University. Dr. Tracy Alloway joins me this morning to talk a little bit about some of that anxiety and pressure that some families may feel when talking to their kids about this. So first off, thank you for being here with us.
Thank you so much for having me, Brianna.
Yeah, no problem. And as we mentioned, many students now face the threat of gun violence from elementary school all the way through college. And I want to talk about how this impacts their mental health.
One of the big things that we know in situations like this is a sense of anxiety, the fear of unknown. And of course, we know that anxiety is a survival mechanism. It's there to protect us. But there is a difference between adaptive anxiety that helps us to be proactive, to take action, and a difference between that and maladaptive anxiety, the anxiety that is crippling, that prevents us from doing anything. So as a parent, be sensitive to your child's level of anxiety. Is it adaptive? Is it encouraging them to be proactive? Or is it crippling them or paralyzing them? And to help them distinguish between the two, you can ask them one simple question, and that is, what can you do? And that simple question puts that agency back to them. It puts this idea of locus of control from my own research that I've identified as a really key factor to let them feel that there is one thing that they can do. Can they, what is in their control that helps them in this moment of uncertainty feel a sense of assurance, feel a sense of agency.
And I wanted to talk a little bit about that crippling anxiety. Let's say a child says, I no longer feel safe going to school in person. Would it be a good idea for a parent to allow their child to be homeschooled? How do you deal with conversations like that?
Such an important question to address. And the goal here is for the parent to look at your child's baseline. Some children tend to perceive events in a very escalated manner. And if that is so, that may be something you want to talk to them about in a calm and reassuring manner. Other children, it takes a lot for them to feel that level of anxiety, in which case you want to be even more sensitive. So again, looking at that in the context of your child's baseline is important. You also may want to give them a safe space to express those emotions. Sometimes with children, we want to keep in mind this idea of mirroring emotions. And this is the idea that when we are anxious as parents, as adults, the child will mirror that level of anxiety, that level of stress. So be aware of that. Your child's anxiety may be rooted in your own emotional regulation as well. So be aware of your own emotional regulation and be sensitive to what their baseline is for their own emotional expression.
And speaking of that mirroring, a lot of times students and parents feel helpless with protecting their children because we've seen these incidents happen time and time again. How do you deal with those type of emotions and overcome that?
And that is a challenge, to be sure. One of the things we can do is shift our mindset on what is concrete, what plans of action are in place, what does the school have as provisions, what can you as a parent offer to your child, what can your child do? So focusing on the concrete action plans can really help alleviate some of that concern around situations like this.
And how do you begin those tough conversations? I mean, it's not easy.
Absolutely. The first goal would be to find a safe and calm environment. So when your child is feeling escalated or highly emotional, that may not be a good opportunity to speak with them. Maybe you want to do it outside the home. Maybe you want to take a special time where you take them out for a treat, an ice cream, a bite to eat, or even a walk where the environment is not the home, it's outside. So there's that dissociation, and approach that in a calm way. Listen to them. Often as adults, we want to just jump in and provide solutions, but this may be a moment where your child just simply needs that space to cry, to express themselves without feeling that they're constantly being spoken at. So I would suggest, again, from the literature, it shows that finding a safe environment is a starting point. Listening to your child is important, and then provide tips for what they can do, that sense of agency. Those 3 things can be an important first step in speaking to your child about this.
Such an important conversation. Thank you so much, Dr. Tracy Alloway. It was a pleasure having you on this morning.
Thank you again.